Hello, it's Dr. Rhonda Johnson. I hope everyone is well. Today is Sunday, June 4th, 2023, and today I'm doing a COVID update. Well, some reports from CBS Online, a news report on June 2nd shows that there's a rise in COVID-19 levels in New York City wastewater. The article reports that all 14 of the city's wastewater treatment plants reported high concentrations of COVID. Now, New York public health officials say it's too early to know if it's the start of a full-blown COVID wave. Now, I just want to remind you what this means. If SARS-CoV-2 is detected in the wastewater, it means that there's at least one person in that sewer shed who is shedding the virus. Whether or not people are infectious or symptomatic cannot be determined from wastewater surveillance data. And remember that wastewater surveillance data tends to rise about 2 weeks before you see an increase in clinical symptomatic cases. So if you want to know what the wastewater levels are doing in your community, go to the CDC COVID data tracker website where it says hashtag wastewater surveillance, and you can find out. Now, speaking of these variants, the CDC COVID data tracker as of May 27th, 2023, that's the most recent update on the CDC website, basically shows that these 5 strains account for 96% of COVID-19 variants. And just to give you a heads up, it's all XBB variants. So XBB 1.5 is 54%, XBB 1.16 is 15%, XBB 1.9.1 is 12%, and XBB 1.9.2 is 6%, and XBB 2.3 is 4%. I know this XBB whatever doesn't mean anything to a lot of people. You know, the differences in these variants just show that the virus continues to mutate. Now, scientists continue to remind us that we are not done with COVID, not even close. The virus is here to stay with us. I know folks want to move on from the pandemic, but the virus is still out there. People are still getting infected. Some people are getting hospitalized, and some people sadly continue to pass away from this. And there's a 10% chance that you can get long COVID, even if you have a mild infection. So I know we need social contact. We need human interaction. I know some of us have been away from our families and our friends, and we're tired of missing out on graduations, weddings, reunions, whatever gathering it is. I understand it. I get it. However, if you want to lower your risk of transmission, you're still in the category that you care, these tips might be helpful. Do as much outdoors as possible. Open a window for air exchange. Use a fan to move the air around. Mask indoors whenever possible. Especially mask when you're using public restrooms and public transportation or ride share. Open up those windows in the car. When eating indoors, try to sit near exit door if you can, where the air circulation is better. If you get the virus, talk to your doctor about Paxlovid. And if you're prescribed Paxlovid, make sure your doctor or pharmacist checks your usual chronic medications if you're on it for drug interactions against Paxlovid. That's my message today. As always, folks, be careful, be safe, and be well. Until next time.